Hi everyone, I am Dr. Maya, Senior Lecturer from Department of Pharmacology. Today we are discussing about macrolides. Macrolides are antibiotics. Antibiotics are the agents which are used for the treatment of bacterial infections. So macrolides, these are examples for protein synthesis inhibitors, and it is naturally obtained from the organism actinomyces like streptomyces. They inhibits the protein synthesis in microbial organisms, thereby produces bacteriostatic effect. Bacteriostatic effect means here it inhibits the protein synthesis and prevents the multiplication or growth of the bacteria but does not kill the bacteria. Examples of macrolides, these are erythromycin, roxithromycin, clarithromycin and azithromycin. Erythromycin is obtained from natural source and all other agents are semi-synthetic agents. Erythromycin is obtained from streptomyces. It is an alternative to penicillin in case of patients who are allergic to penicillin. And it is safe in pregnancy also. Mechanism of action of all macrolides: by binding to the 50S ribosome of bacteria, it will block the translocation step. Translocation step means here the movement of peptide chain from A site to P site does not occur. Hence, it inhibits the protein synthesis and produces bacteriostatic effect. The figure showing an initiation complex. Here we have a 50S ribosome and 30S ribosome and corresponding mRNA. Macrolides inhibits the translocation step, that means it inhibits the movement of tRNA with amino acids from A site to P site. Spectrum of activity. It has narrow spectrum of activity and the spectrum is similar to penicillin. It is active against cocci organisms like streptococci, pneumococci, gonococci and meningococci, and gram-positive bacilli like Clostridium diphtheria, Clostridia and Listeria. It is also active against some gram-negative organisms such as Legionella, Mycoplasma, atypical Mycobacteria and Haemophilus influenzae and H. pylori. For Mycobacterium avium complex, we can use azithromycin. It is also active against some oral anaerobes. Erythromycin, the adverse drug reactions are it produces gastric upset like nausea, vomiting and causes diarrhea. It can cause hepatitis and allergic reactions or hypersensitivity reactions. It causes hearing impairment. Erythromycin has some disadvantages. It has narrow spectrum of activity compared to other members of the same group. It is destroyed by gastric hydrochloric acid, hence given in enteric coated tablets. It is an enzyme inhibitor and causes toxicity of the co-administered drugs like warfarin, digoxin, etc. So it causes prominent drug interaction. And it has more GIT side effects compared to other members of this group. The most commonly used macrolides is azithromycin. It is more preferred because it has better spectrum of activity. It is more active against H. influenza, Mycobacterium avium complex, Mycoplasma and Legionella. It is acid stable, does not destroyed by gastric acid. Rapid absorption occurs if we take the drug from empty stomach, and long-acting agent and given once daily. If we use erythromycin, it has to be given 4 times a day. Compared to erythromycin, azithromycin has less GIT side effects. Uses of macrolides. In dentistry, we can use for orodental infections like periodontal abscess, pericoronal abscess, periapical abscess, ulcerative gingivitis, etc. It is also given for post-extraction infection. Medical uses of macrolides against cocci infections like streptococci or gonococci. We can use for respiratory infections, tonsillitis, pharyngitis, otitis media, etc. It is an alternative to penicillins for the treatment of gonorrhea caused by gonococci. In case of syphilis, we can use as alternative to penicillin. Then can be also used for anthrax, tetanus and diphtheria. In case of diphtheria, the drug of choice is macrolides because these are effective in acute stage and eradicates the carrier state. It is drug of choice in case of atypical pneumonia due to Mycoplasma, Legionella and Chlamydia, and whooping cough or pertussis. Clarithromycin is used in WHO recommended triple drug therapy of peptic ulcer. It is used for atypical mycobacterial infections in AIDS. We can use azithromycin, and prophylactically it is used for rheumatic fever, dental chemoprophylaxis for the development of bacterial endocarditis. Macrolides can be used as an alternative to penicillin in patients who are allergic to penicillins, and these are safe in pregnancy also.